You do the beds? Yeah. Yeah, sure. Rockefeller? Yeah, my friend, don't mind. Please. Oh, okay, you invite him.
Yes, let me invite him. Thank you, Waziri. Ladies and gentlemen, the first thing I would like to say is that I would want a moth to be wrong. Models are made so that you're wrong. They are not made so that you achieve them. Models are made so that government plans and you get them wrong. If they get them right, then there's no need of modeling because then it means you didn't plan. So we hope a moth is wrong, but we hope he's right to allow us to plan. That's really important to understand. So don't look for the numbers, look for the action. The next thing I would like to say is that in this line of defense, in this battle, we have two lines of defense. One is individual, you and I. So please let us obey what the experts and the government are telling us so that we can apply that first line of defense. The second line of defense is our health workers, our doctors, our nurses, our clinic officers, our lab experts, our community health workers engaging communities out there. And these need to be supported and need to be protected. And this is what Waziri has spent time talking about today. So I would really like to thank Rockefeller Foundation, because when the call came from KNH and the ministry saying we need to protect and support our health workers by putting up a center that is for them in case you have any incidences, Rockefeller came forward, and we really wish to thank you. They have donated about 100 beds which are going to be put into these centers. They have donated preventive equipment that are going to be used, ventilators and monitors for standby. We honestly hope they are not used at all, but it's always good to plan and have them on standby. So what I would like to do is ask the Rockefeller MD, Mr. William Masiko, to make a few remarks. Thank you, Waziri. Thank you.
Thank you very much, Dr. Githinji Gitahi, Waziri, and the rest of the senior management team from the Ministry of Health. First of all, mine is just to thank you very much for your precise leadership, transparency in this fight. When I came to see you nearly 2 weeks, just over 2 weeks ago, Waziri, you told me that you do not want words, you want action. And I'm very glad that in just under 2 weeks, we have been able to come and support you in your strategic fight against this enemy that nobody could have foreseen coming. Thank you very much for giving us this opportunity to serve you. Frontline healthcare workers are sacrificing so much. And as you said, in many countries, they are even giving the ultimate sacrifice by giving up their lives. We do not want to see that here. And we are very, very, very happy to support this. And as you said, we hatutachoka. We will stand by you. We are here. We are in the beginning of this fight. Nobody knows where it is going, but we will be there throughout. Thank you very much for this opportunity.
Thank you very much, William. And so that you can see me, I'll remove this and then I'll put it back as well. And this is how you hold it, not on the mask itself. I would now like to ask the health workers themselves to come and make some remarks because they are the people in the front line. So it's always good to hear from them. So I'd like to ask the chair of the Nursing Association to come and make a 1-minute remark.
Thank you, Bwana Waziri. On behalf of the nurses and other healthcare professionals, I just wish to extend our gratitude to our partners, Rockefeller and AMREF, for this generous help that they have extended to us. And as you've said, we don't wish to get there, but we must be ready in case we reach there. And I also want to urge that the package, the welfare package that was announced by the head of state, His Excellency the President, Uhuru Kenyatta, be unpackaged, and we hope that it will be commensurate to the sacrifice that health workers are giving at this critical time. Asante sana.
Thank you very much. Yeah, you can clap. I would also like now to invite the chair of the clinical officers to also make a remark, and then I'll ask the President of Kenya Medical Association to follow, who is here with me. So clinical officers, yes.
My name is Manasseh Bocha. I'm the Chief Clinical Officer in the Ministry. Waziri, we want to thank you very much for your initiative to have this facility to take care of frontline health workers. As you know, clinical officers have been first affected with this COVID-19 disease. And the question they've been asking is, if we are isolated, are we going to pay for ourselves? But now with this answer, we want to thank you very much. Thank you so much.
The President of KMA.
Good afternoon, everyone. I really want to take this opportunity really to applaud each and every healthcare worker, not just the doctors, the nurses, the clinical officers, the lab technologists, radiologists, every one of us. Thank you for standing out there and being on the front line of this battle. This is a different battle where it's the healthcare workers who are at the front. I want to thank the government too for the effort it's making in ensuring that these healthcare workers are protected and that they have adequate PPE. They need to be safe so that they can work and make sure that they keep the population safe. Of course, in the line of duty, remember these healthcare workers are just like you and me. I am one, but all of you out there, everyone has a fear about this COVID-19. So let's not imagine that the healthcare workers do not have a fear as well. And they are working under a lot of pressure. So as the Kenya Medical Association, in association with the psychiatrists, the clinical psychologists, we've set up weekly debriefing sessions to ensure that they also have psychological support. Further to that, we are also making sure then that the healthcare workers are trained. We are using innovative methods, ICT, to ensure that they also know how to protect themselves. In the line of duty, some people will get affected and will be exposed and may turn positive. And indeed, we are very delighted today that this building here that has been launched for making sure that there is an isolation and treatment center available to healthcare workers is something the healthcare workers of this nation will be proud of. Thank you very much, Rockefeller Foundation. Thank you very much, AMREF. Thank you very much, Ministry of Health, for taking care of the healthcare workers. Would also like to urge the healthcare workers, knowing that even as we get exposed, that we need to take this opportunity to ensure that we come in for testing, that we get tested, and that if we are tested and have been exposed, that we do follow quarantine rules. They apply to us as well. And this is for the benefit of our loved ones, our families, and for the benefit of the patients. All of this is to ensure that we are all looked after in a humane manner. So I will just conclude, Bwana Waziri. For us as in the medical profession, we do have a physician's pledge. And in that pledge, this is what we say at part of it. As a member of the medical profession, we solemnly pledge to dedicate our lives to the service of humanity. The health and well-being of our patients will be our first consideration. We will respect the autonomy and dignity of our patients and will maintain the utmost respect for human life. So stay at home, keep safe, keep social distance, wash your hands, and ensure that when you stay that way, you also keep us as the health workers safe so that we can serve the community better. Thank you.
Thank you.
Thank you. Thank you very, very much. And I would now like to invite Kefa to speak on behalf of the public health professionals, because they are also in the front line in this response. Kefa, please.
Thank you very much. I think what we want to say is that we are very happy with the moves of repackaging and support to the health workers wherever they are. Our call to all public health specialists, public health officers, and public health specialists fraternity is that this is our opportunity to give our best. And indeed, the call for this moment is the highest basic observation of what requires to be done. And I think I want to call our colleagues wherever they are to give their best on behalf of Kenyans. This is the only time that we can give our best. Thank you so much.
Thank you very much. And finally, the chair of Kenyatta National Hospital board, so that he can then receive the equipment.
Engineer. Very good, Mosh.
Waziri and all the health professionals here present today. Allow me, Waziri, to start by thanking you most sincerely from the bottom of my heart
for the dedication, commitment, and selflessness that you have shown in the fight against this disease. People can be given jobs, but many times people do not lend their hearts to those jobs. And most of us, Waziri, believe truly that you've lent your heart to the fight of this disease, and through your leadership, Kenya will be much the better in confronting and defeating the disease. Ladies and gentlemen, we are here today to hand over the Isolation and Treatment Center for our frontline warriors in the fight against COVID-19, the healthcare workers. We must all appreciate that above everything else, healthcare workers are also human beings like you and me. They have anxiety, they have fears, they have families. They don't just need this kind of support, but they also need psychosocial support, and that falls upon you and me to do it. And therefore, in that regard, I thank most sincerely AMREF Foundation and the Rockefeller Foundation on behalf of the Board of Management of Kenyatta National Hospital for this timely event, this timely donation that's going to go a long way in making sure that we at all times communicate to our healthcare workers that we do care about them, we do care about their commitment as the frontline fighters on this disease. Of course, it is our hope, like Waziri said, that we don't admit a single one of them into this facility, and that's really our prayer. And I think from where we stand, Waziri, we have a lot to learn from. The mistakes that other countries have made, we don't want to repeat those mistakes. But most importantly, to AMREF and the Rockefeller Foundation, what you've done today goes to show what we need to do as the global community in order to be able to confront and defeat this disease, which is international collaboration. This disease does not know about social status. This disease does not know about who your father or your mother is. This disease does not know where you were born. This disease does not know how much money you have in the bank. As a matter of fact, some people, I'm told, when I was just being told yesterday, some of the most worried people today are those who have big bank accounts in other countries which they cannot access right now because of this disease. So really, this is what we need to do. As I conclude, Waziri, there's been this misinformation as Kenyatta National Hospital that now we are not doing anything else other than dealing with COVID-19. Nothing could be further from the truth. As Kenyatta, and on behalf, and because we are the leading healthcare provider in this country, we are the apex institution in healthcare provision, I want to assure you that we are all still attending to all other clinical conditions. Of course, this is a priority, it's a global priority. It is a priority for the nation, but let no one tell you that if you come here with any other clinical conditions, we'll be turned away. We are here to receive you, and we'll be doing our best. And I want to thank our frontline staff, especially those at Kenyatta National Hospital. They have gone beyond the call of duty just to make sure that we are all assured and we are all kept healthy. And wherever you are, whether in the media or wherever you are, wherever else in this country, please, we owe it to make sure that we give them psychosocial support, any kind of support, encouragement, so that they know the whole country is behind them. I thank you very much. May God bless you. May God bless our great country.
Well put, Chairman. Thank you. Very nice words.
Yes. So we now hand over the beds to the Ministry of Health and the chair of Kenyatta National Hospital and the health workers as well.
Well, you've heard it from the Ministry of Health officials, and the live pictures that are coming for you are donations from well-wishers. This is that is AMREF and the Rockefeller Foundation, and these are just samples of many others. Angalia picha ndugu yangu, ingia kwa live yetu bana. So maybe we anticipate this will go a long way in helping in the fight against the COVID-19 and these hard times that Kenyans are facing. Well, a good evening once again, and those have just been live updates of the coronavirus pandemic situation in the country from Kenyatta National Hospital, where the highlights of today have been that Kenya has recorded 11 more cases, and that brings the total of people who've tested positive for COVID-19 to 281. And out of the 11 people, 7 are Kenyans, and they are from Mombasa. And those from Mombasa are 3 from Bondeni, that is Old Town. And then we have the rest from Miritini, and 4 are from Nairobi in Ruaka. And I can imagine the Ruaka area with the population there. Probably this is something to worry about, but it's again an encouragement that you need to probably ensure that you're taking care of yourself and protecting yourself and taking the necessary measures that are required to ensure that you're safe. So basically, out of the 11 that have tested positive, 7 are from quarantine centers around the country. And then there's some more good news. That is 2 patients have recovered today. And these 2 are doctors. One of them has recovered and the other is yet to recover. And this brings the total number of recoveries in Kenya to 69. Again, another thing to probably put a smile on our faces. No deaths have been recorded today. And the deaths around the country still remain at 14. Well, the CS for Health, that is Mutahi Kagwe, has again said that 455 people have been quarantined for defying national quarantine measures around the country. And basically what they are doing is if you're caught probably forfeiting the laws and regulations that have been set in place, you're taken to quarantine for 14 days, and that is mandatory. And it is worth to note that it is at your own cost. Yeah, again, what the CS highlighted today is that the government has actually supplied 4,759 kits so far around the country to continue strengthening and enhancing the fight against COVID-19. And out of the 4,759, 237 are assorted components, which include rubber boots, probably masks and goggles. And again, to continue enhancing the fight against this pandemic, the government has trained over 30,000 personnel so far, and 1,000 policemen also have come in handy, probably, and gone through the training, and then another 1,000 NYS, that is National Youth Service officers, plus 300 prison officers to probably ensure that Kenyans are kept safe and this pandemic is stemmed at the very stage it is as at now. So again, another thing that probably was encouraging today is that the government says that it is launching a facility for health care workers around the country that will offer support for critical care and ensure that any basics that probably are needed to ensure that anyone is safe are taken into account. Basically, that's it from us today, and most importantly, I'd like to urge you to continue taking care of yourself. Please self-isolate. This disease, as the CS initially said, is that if we continue treating it normally, it's likely to treat us abnormally. So it is good to ensure that we are following all the regulations that have been put in place. That is self-isolation, which is very, very important. Please let's not party like we've seen recently, people hiring ambulances and going for parties at night during the curfew hours. Again, wash your hands, which is important, and make sure that we are keeping safe the elderly. And that's it from me and from us today. My name is Kevin Phillips Momanyi. Hope that you will catch our next live update of what is happening. Thank you so much for always joining us. And maybe just before I close, let me just mention a few of your comments. For those of you who are watching, I can see there is Carol James, one of our top fans. We appreciate you. You're saying, what is the issue of the mask? You should be an example. Cover your nose. Okay, I hear you. Top fan. Probably I've covered my nose, Faith Mugai. I get your concerns. Fauzia Nguye, you're catching us from Mombasa. How is Mombasa? 7 more cases. We hear from that area. Please keep safe. Glenn Carlon Maratas, you're watching from the Philippines, all the way from the Philippines. Awesome. I hope you're keeping safe too from there. I can see Joel Mamati watching from satellite. Hope you're keeping safe, Joel, which is very, very important. Those are just some of the feedbacks I'm able to look at, and I wish you all the best. Stay safe, keep safe. Cheers.